I am also a certified birth doula through Secrets Kept in Nature out of Durham, and a certified postpartum doula and certified placenta encapsulation specialist through Women's Choice Perinatal Services out of Connecticut. I have been in my doula role since 2022 after the birth of my daughter, which was in 2020. What inspired me to become a doula was me hiring a doula. So around 2020, when the world shut down, I definitely felt like I needed another advocate with me in the hospital room. I initially planned to give birth at home, but as we know, we can plan as much as we want. Sometimes they go the way we want, most times they do not. So I'm excited to be here with you all and to go over birth plans and birth preferences. Circulating is the Penny Simpkins Roadmap to Labor, if we can kind of get that going table to table, as well as a doula deck of cards that I created that also visually shows different comfort measures as well. Later on in the presentation, once we get to role playing, I have a bag of goodies, a big bag of tools that is used in hospital settings, birth center settings, as well as home settings that I use that we will go over much later in the presentation. So what is a birth plan? So a birth plan is a document given to the care team that explains the wishes of the birthing person or parents for the care that is given during the process of labor and delivery. There are many different preferences that the birthing person may wish to display. Always having a written PDF document in the hospital, or just making sure that the birthing person have it in their hospital bag before admission is always good practice. Why use the term birth preferences? So a plan sounds like something set in stone, something that will definitely happen. And in my experience, I have not been a doula for a very long time, but from the clients and patients that I have supported, they usually have this mindset of what they expect it to be like, whether they are first-time mothers or this is their third or fourth child, and every pregnancy is different. So with a plan, you can kind of base, what your last experience was like, or what you've been educated on or seen the experience to be, but it does not always go that way. But it's always great to have something written on document. Your access to birth preferences as a doula. So when introducing yourself, you can ask if they have any specific birth preferences or what they would like their birth experience to be like. You can also ask what has been working well for you, either with previous pregnancies or even seeing family members or friends have children. Of course, consent to touch, what types of support they may be interested in, what setting they will be in, and we will go a lot more in depth once we show you an actual PDF birth plan. So skin-to-skin contact is very important. So the dry infant is placed directly on the birthing person's bare chest following delivery. It creates that bond with mother and instantly starts to initiate breastfeeding upon delivery. So the benefits of skin-to-skin contact is calms and relaxes the baby and the birthing parent, regulates the baby's heart rate, breathing rate, glucose levels, and temperature, stimulates hormones to promote interest in breastfeeding and the oxytocin, the love hormone, stimulates skin colonization based on birthing parent's microbiome. And the goal is to do skin-to-skin at every birth, but sometimes the care team needs extra help to get that done. How to advocate for skin-to-skin as a doula. So remind them that skin-to-skin can be done with non-birthing parents. So usually if mother is too exhausted or she needs a minute or she's being repaired or being stitched, sometimes the spouse or partner or any other family members can do skin-to-skin with baby while mom is recovering, as well as the baby can get back to mom if there are no spouse or partners in the room as well. So to help facilitate skin exposure by removing their gown, and if spouse or partner is there, no shirt. Skin to skin is beneficial during the hours following birth, not just immediately afterwards. So helping with breastfeeding. So I always recommend an internationally board certified lactation consultant to help with breastfeeding, although registered nurses can help with breastfeeding as well. And even doulas as peer counselors or certified lactation counselors can help with breastfeeding. So we are going to move right along to comfort measures and
Oh, sorry.
No
I
problem.
have a question. With breastfeeding, if the mom has opted not to do breastfeeding, do you encourage like use of formula after, or like how do you supplement your role as a doula?
Yes, so if mom does not want to breastfeed, and it could be an array of different reasons. It could be from past trauma,
Right.
it could be not necessarily feeling that bond with baby in that moment. Sometimes that's initiated once mom is discharged from the hospital and gets back home in the comfort of her own space. There are alternate feeding methods. Formula, donor milk is always an option as well. So I usually like to recommend those two, formula or donor milk.
Thank you.
You're welcome. So pain during labor. How is pain caused by labor? So the dilation stage is contractions of the uterus, stretching of the cervix, stretching of pelvic ligaments. The birthing stage is when baby is transitioning from the birth canal out of the vaginal area. Contractions of the uterus, stretching of pelvic floor muscles, stretching of pelvic ligaments, and stretching of the skin around the vaginal outlet. So here is a description or picture of baby transitioning through all phases.
Surge in interest, I think, returning among women who want to take an active role in their births. We've had films, we've had books, we've even had play written about this. And I think women all over North America are interested in participating more actively in their births. But after being inspired to do so by these media, they're often thinking, well, how on earth do I do it? And that seems to be an area that I can help with. So I decided to put together a collection of comfort measures and show exactly how and when to use these during labor. The pain of labor is a side effect of a normal process, and it's nothing to fear. We have other examples of pain in our lives that we are not fearing. For example, the pain associated with physical exertion, mountain climbing, athletics. We accept those, and this is the same sort of thing. So pain doesn't have to rule the labor and overwhelm the woman. When her care providers believe that's going to happen, they keep reminding her, you can have medication now, you can have an epidural, you don't have to feel a thing. And when she doesn't feel a thing, it takes away the feeling of the pain, but it also takes away the feeling of the birth and the joy. Because all the pain medications do interfere with the hormonal process that is making her look forward to the birth and accept, and be overjoyed with the birth of her child. Well, let me try to make a distinction between the definition of pain and suffering. Pain is a physical sensation, and it's an unpleasant one. It's sometimes associated with damage, but it can be associated with, as I said, physical exertion, muscular exertion, etc. Suffering is a sense of being overwhelmed, of being helpless, of being out of control. You can have suffering without any pain. People can have emotional suffering when they're deprived of something, when they lose a loved one. They have no physical sensation that causes it, but it's emotional suffering. So in childbirth, yes, many women suffer in childbirth, and it's because they're not kindly treated, they're not respected, they don't know anything to do for themselves, which is the topic of my DVD. They feel unloved, so that they feel alone. And that can turn the pain into suffering. We don't need that. And so, my cause, my whole quest is to keep it as pain, this manageable. If it becomes unmanageable, then I'm all for using pain medications. I don't want any woman to suffer in childbirth. No woman should suffer in childbirth. And if she crosses that line of suffering, then, well, we failed her. And that's the one thing I cannot allow to happen. So I want her to be well equipped with comfort measures, with the support she needs. And many women are going to manage their labor very well with that, or they may get to a point and feel that they want some pain medications along with it. And that's their choice. But I hate to have them take pain medications because they know nothing they can do for themselves.
I gave birth at UNC Chapel Hill. My water broke around 8 a.m. on a Sunday, and she arrived 36 hours later. She also went through a little bit of what the story was yesterday, a little bit of shoulder dystocia. My midwife actually had to intentionally fracture her clavicle to get her out, but it was very minor. She didn't really react to it that much, and she grew out of it. So she will never even probably remember that. And it wasn't a very traumatic birth, I will say, because my midwife and my doula, they went over several comfort measures with me. So I will also say that with having birth preferences and creating a birth plan, all of that goes out the window once contractions begin to hit. So it's very good to have a plan and to discuss preferences with your mom's provider or the birthing person's provider, care team, the nurse on call that day, and just having the entire care team on one accord. But again, plans kind of go out the window once contractions begin to hit. And pain management starts to play a role during that process. So the 3 R's are relaxation, rhythm, and ritual. Relaxation, the laboring person is able to relax during or between contractions. This is mainly during the early stage of labor. Once mom begins to experience more frequent contractions, I like to encourage, this is the time where mom gets something to eat, mom rests, try to sleep as much as she can, because she's going to need all of her energy for the active labor part. Rhythm is the laboring person uses rhythmic movement, breathing, or vocalizations to cope during contractions. So a lot of moaning, a lot of oohs, a lot of ahs, deep belly vocalizations to help mom or the birthing person breathe through each contraction. Ritual, if it ain't broke, don't fix it. A set way to deal with a contraction that increases the laboring person's confidence in their ability to cope will change as labor progresses. How does a doula help? So you can help them keep their rhythm by counting, moving your hands or body with their motion, getting up and getting in the action with them, praising them in their rhythm, letting her know she's doing a very good job with every contraction. She's getting closer and closer to meeting her baby. Refrain from disturbing them during the contractions. Stay calm, confident, and caring throughout the process. So specific comfort measures. Psychological comfort measures include guided relaxation, attention focusing, distraction, visualization. Music is a big one, aromatherapy is a big one, and also hypnosis. So guided relaxation looks like for where they are holding tension, which is usually in their lower back area, always their hips. So double hip squeezes are very pertinent with laboring people. Attention focusing and distraction. So the goal is to divert the laboring person's attention away from the pain and contractions. During early labor, distraction can be used by walking the hallways of the hospital, talking, playing games, different activities. When pain is more intense, concentration can be refocused to anything else, using your voice, mantras, affirmations, letting mom know how beautiful she is in that moment, because in that moment, moms do not necessarily feel as they look. So just continuing to encourage her, to let her know she's doing a great job, how great she's doing, and keep that rhythm going. Pictures or items also. Visualization, the goal is to divert the laboring person's attention away from the contraction and pain, bringing up good memories, remind them of the baby. Also, if the laboring person has other children, talking to them about their current children as well as baby-to-be. Rhythmic breathing techniques and moaning. The body's natural response to pain is either to hold your breath or to hyperventilate. That's what we do not want. We don't want mom clenching up, tensing, and holding her breath. We want her breathing throughout each contraction in a very rhythmic way. So breaking this cycle by focusing on breathing techniques is helpful. Distracting by giving something else to focus on, physical relaxation techniques, and it can be used in any type of birth, whether that is medicated or unmedicated. So rhythmic breathing techniques and moaning. So slow breathing, you slow inhale, pause, attempt to relax with each exhale. Audibly sighing or moaning on the exhale. To be most relaxing, it shouldn't feel like work, to keep the rhythm slow. Light breathing, 2 short light breaths through the mouth, 2 short exhale, pause, and repeat. Physical comfort measures can include touch, massage, counter pressure for back pain, double hip squeezes, acupuncture. While mom is pregnant, I have not seen too much of acupuncture during active labor, and I am not a licensed acupuncturist, so I have not experienced that just yet. Touch or massage. Gentle touch can be comforting and reassuring for the laboring person by embracing them, holding them, stroking their hair, scratching their back. Rhythmic touch, rubbing can help reaffirm the rhythm that they're using. Holding or squeezing portions of their body to also ground them. And simple massage is to extend. Holding tension during contractions will eventually lead to sore spots. So here's a perfect example of counter pressure for back pain. This can be used during contractions if the laboring person has pain in their back. Press the heel of your hand into the lower back buttocks area as they lean over the bed or birthing ball. The best spot may vary per person, so you may need to adjust. And we will do some role-playing techniques a little bit later on today. So the double hip squeeze can be used during contractions if the laboring person has pain in their back. With the laboring person kneeling, press inward on the roundest portion of their buttock with your whole flat hand, and can be difficult and tiring for one helper to elicit help from other companions. So the spouse can get involved, the partner can get involved, sometimes the nurses get involved, but you as the doula, you want to make sure that you are the main point of contact. You're up and active with mom. I have one in my birthing bag, but it's very beneficial. So abdominal lifting is a sheet or rebozo wrapped underneath the pregnant person's belly with a wide base. The support person pulls up and back to relieve gravity on the pull of the abdomen. And I will say mothers love abdominal lifting. It relieves a lot of pressure off of their pelvis. So here is what a rebozo looks like. It is used by Mexican women for a variety of reasons. I've seen a lot of Hispanic women use it for child carrying, and as a doula, you can use it as a support tool during pregnancy, for massages, and there's also a technique called shaking the apples that you use to put the rebozo on the lower back and gently sway back and forth in a rhythmic motion to relieve pain during contractions. So different positions. So standing, and along with the positions, the cards that are going around also show different positions during labor and delivery. So standing can be supported and unsupported depending on the needs of the person. The doula and or the spouse or partner can have mom's arms around their neck and just gently swaying back and forth during contraction, takes advantage of gravity, helps babies position head down into the pelvis. So it helps baby to descend into the birth canal. Walking and slow dancing, so walk in the halls, that slow dancing that I just described also takes advantage of gravity. It may progress labor or increase the urge to push in later stages. Leaning forward, using the bed or using the birthing ball, same advantages of standing. Increased support for standing, maybe more restful, can help relieve back pain, easy access for back and shoulder rubs. Standing and kneeling lunge, same advantages of standing, widens the side of the pelvis that they are leaning toward, gives room for baby to rotate and continue to descend. Sitting upright. So the toilet is a very good dilation station for mothers. A lot of labors progress very quickly with mothers sitting on the commode. It is a very good position to keep the area open, and can be done with even an IV or a fetal electric monitoring. It's very restful, so it's not taking a lot of energy out of mom in this position, but it's helping to continue to progress labor. Sitting upright with movement, so a rocking chair, bouncing on the ball. Similar advantages to sitting, can help keep rhythm during contractions. Hands and knees, all fours. A lot of my moms think it's so funny when I say how you made the baby is how you gonna get the baby out. So it's very helpful to be in hands and knees. Helps relieve back aches, assists in rotation of baby's head, can allow for rhythmic movements like pelvic rocking, cat-cow position, and stretches. Sitting or kneeling, leaning forward, similar advantages to standing, leaning forward, more restful position than standing due to increased physical support. Semi-sitting, so similar benefits to sitting upright, take advantage of gravity, can be done even with an IV or monitoring, very restful. Tilt makes interventions like a vaginal exam possible. One knee to chest position, uses gravity to move the baby's head out to the pelvis, can be helpful if baby's head needs to rotate before descent. Pressure needs to be reduced on a swollen cervix, or reduces urge to push when it's not a beneficial time. Meaning if she is not 10 centimeters dilated yet, this is still a good position to help progress that labor. Side lying semi-prone, so this will be beneficial using the peanut ball. So of course the birthing ball is the large ball that mom is able to sit on, and a peanut ball is more of a smaller ball in the shape of a peanut. So this is very good for mom to sleep and get some rest, but to continue to keep that during, yes ma'am.
In the hospital, will you always have access to the birthing ball? Like, is that like available?
So I would say yes.
Okay.
And I haven't been to Baptist in a very long time, but they have one for each room.
Yeah, usually, well, when we do birth center tours, we'll like show you, usually they put them in the bathroom, because they like clean them off between like patients. But like usually you'll be able to find them in there, and if they're not in there, you can just talk to the nurse and be like, you know, we don't have a birthing ball and peanut ball.
Okay.
Yeah.
I also, so along with utilizing hospital resources, I always keep those two things in my birthing bag, depending on which setting I'm at as well. Pushing in sideline positions. So I do encourage clients, patients to push in alternative positions. There are several different positions mom can push, not just lying on her back. So sideline is a very good pushing position. Hands and knees is a very good pushing position. Any positions that help helps with gravity instead of working against gravity. So squatting is a very good position as well. This is a squat bar. You can also use a reboza to tie one end to the squat bar and have mom pull the other end, like in a game of kind of tug of war, to help push baby out during contractions as well. And I think there's a picture that you all will be able to see a little bit further in the presentation. So squatting takes advantage of gravity, opens pelvic outlet to help baby descend and rotate, and may relieve back aches. The dangle position takes advantage of gravity as well, lengthens laboring person's trunk and gives baby room to maneuver. On back with legs drawn up, tiring for the laboring person that works against gravity. In some cases, it helps to have the birthing person on their back, and sometimes it does not. So it's on a case-by-case basis. But it may be helpful when baby's head is having difficulty descending beneath the pelvic bone by rotating the pelvis upward. Positions to use in certain situations. So positions to help with back pain. There are many other reasons for back pain during labor. Positions to help with back pain continued. Positions that encourage rotation are standing, kneeling, lunge, squatting. Positions that relieve back aches are hands and knees, open knee to chest, sitting, kneeling, leaning forward, and squatting. Positions to help with a cervical lip. A cervical lip occurs when the cervix dilates unequally, discovered in late active labor or the transition to the birthing stage after the vaginal exam. When choosing positions, use gravity to your advantage. The alternate position, side lying, hands and knees, etc. Positions to help with pushing. Again, hands and knees, sitting on the toilet, very good dilation station. Semi-sitting, squatting, using the birthing bar, side lying, etc.
Watching YouTube videos, wondering why you can't find the motivation to do the things.
Alright, so when we're pushing and baby's coming out of the bottom portion of the pelvis here, so the outlet, we want to focus on infra rotation of the femur, so knees together, feet, ankles wide, so that way we're opening the bottom a little bit more. So you can see the white dots move farther apart. Now, if she brought her ankles together but then spread her knees, you can see that the dots get closer together, so it's closing that space up just a little bit. Now, go back to internal rotation. So, in this position, her knees are super close to one another. You can still spread your knees pretty wide and still have internal rotation by having the feet be poked out. And it doesn't have to be this exaggerated. It can just be like a little bit, and you're still opening this more. So now we can do this in any position. It doesn't just have to be in all fours. It can be on her back. So if other people were holding her legs, we just have to take a little bit of an internal rotation. So ankle just a little bit. No shoving, just a real gentle push. The other thing that we can do is sideline with the peanut ball. So we're going to put the peanut ball between the ankles if she was just resting in between. This is going to bring that internal rotation to the femur. And the other one, she could be sidelining and someone could hold her leg for her as well. So we're still thinking ankle out farther than the knee, and it's going to help create more space in that outlet.
Hey mamas, how many of you are watching this while you're sitting down or lying back in bed? I'd probably say most of you, and I don't blame you.
So using the squat bar while pushing. So this is a depiction of the rebosa and squat bar combo that I explained a few minutes ago. Tools in the birth center. So you want to utilize all the resources that you have while you are in the space with the birthing person. So the nutrition room is a great area to grab ice chips, depending on if she's on a special diet, water, snacks. I always keep a bag full of snacks for my clients while I'm in the birthing setting. Towels, washcloths, sheets. A lot of moms like the cool towels on their heads while they are laboring, blanket warmers, and definitely fans. It gets hot. Chuck pads, so used on the bed to absorb any fluids found in various places throughout the setting. So the birth ball is used for support and positioning found in each room, and just like Taylor said, a lot of chuck pads help eliminate the friction while mom is bouncing or rotating on the birth ball. Peanut ball, here is a picture of different positions that can be used with a peanut ball. The bed, variety of positions, including upright supported sitting, This position here is called the throne position, and I have witnessed how beneficial it is to have mom sit upright in throne position to progress labor as well. The birth stool, used to support pushing by using gravity and squatting, found in equipment closets or tub rooms. So this is a more harder one. I've also seen an inflatable one called the cubby. Is it the cub or cubby? There's like an inflatable birth stool. It's very large, but it's the same. It's used for the same purpose. It's just inflatable. The squat bar, used to support squatting position, found in every room. Again, a reboza and squat bar combo are really effective during contractions and laboring. The shower, so private bathrooms in each birthing suite. This would be a great thing to suggest, but might be better for loved ones or spouse or partner to support and help with. May need to enlist help of nursing staff if there's an external monitor or IV to make it easier. The tub room, so Swedish bars, bathtub, hanging bar, and double bed.
And the picture in the top right is what they look like at Atrium.
At the stages of labor, so pre-labor can last days, weeks, but mom is still at 0 centimeters, dilated. Early labor is usually between 0 and 5 centimeters. Active labor is between 6 and 8. And the transition period is between 8 and 10. And of course, 10 centimeters dilated is when the birthing person is allowed to start pushing. So pre-labor, the essence of pre-labor is the intermittent, non-progressing contractions lasting for hours or days. Cervix is softening, thinning, and moving forward in the pelvis to prepare for birth. How can a doula help during the pre-labor phase? So encourage distracting activities, help find them coping mechanisms, ensure that they eat and drink, and that they are resting as well, accumulating their energy for active labor. Early labor, the cervix continues to thin and dilates to about 3 centimeters. Contractions increase in intensity and frequency. How can a doula help? Continue to distract, use gravity to your advantage, assess their ability to cope, and model patience and optimism since this process is often very slow. Getting into active labor. So the tail end of early labor as contractions began increasingly intense and close together. Difficult stage as laboring people often struggle to give up control. Dilation is between 3 to 6 centimeters. How can a doula help? So communication tends to break down during this stage. Talk in soothing tones, very light. Do not interrupt contractions. I also like to suggest that while having a bag of tools is great and having a birth plan is great, like Taylor suggested, it's also great to be hands off sometimes as well. Just kind of let mom do her thing. If you see she is struggling, then that's when you want to interject. Active labor. This is the end result of the transition. The cervix is dilating from about 5 centimeters to 9 centimeters. Contractions last a minute or more and come every 4 minutes or fewer. How can a doula help during this phase? Help them to find or maintain their rhythm. If you are part of their ritual, give them your undivided attention. Remind them to hydrate, use the bathroom very often. An empty bladder helps to continue to progress labor. Break out comfort measures such as fans, hot and cold compresses for their foreheads, massage, and change positions frequently. So the transition to the birthing stage. The essence of this transition is the cervix finishes dilating, usually lasts less than an hour. The urge to push might begin, and they may begin spontaneously bearing down. How can a doula help during this phase? Continue the same rituals, remind them that this period of time is very short, and they'll soon start to push. The resting phase. So not every laboring person has a resting phase, and they may progress directly to the descent phase of labor if their baby is already low in the birth canal. Contractions may subside for about 30 minutes as the uterus catches up with baby and then begin again. The birthing person may get a second wind and seem very clear-headed. How can doulas help? Be patient and remind them that the urge to push will come eventually. Suggest a change of position, and providers and caretakers may suggest pushing before the urge comes naturally. So just continue to review her preferences, review her plan, help the birthing person and their companions advocate for themselves accordingly, as well as that is what a doula is for, to advocate for them. The descent phase, so strong contractions resume to push the baby down the birth canal. The urge to push becomes instinctive and involuntary during each contraction. So contractions do show up on the monitor, but mom knows her body better than the monitor does. So you may physically see a contraction on the monitor, but mom knows when it's time to push and when it is not. How a doula can help during this phase is reinforce their efforts and praise them with each push. Help with position changes if needed. Remind them to relax the perineum area and assist the provider and other caretakers with small tasks during this phase. So what are signs of pushing? Grunting, moaning, breath holding, wincing. I feel like I need to go poop. That's a big one. You know it when you've seen it. So during the pushing phase, I will say that mom taking a deep breath in, pushing down for 10, and letting her breath out helps the pushing process. So laboring down delays pushing even further. Take advantage of contractions that lower the baby further into the birth canal. Common in birthing patients with an epidural, since they don't have the urge to push, they are numb from the waist down, so they usually have to go off of what the nurse is telling them, what the monitor says, so they may not have the same sensations as an unmedicated birthing person. There are some variation of what providers are comfortable with. The transition period is deceptively long, and it can take a while to actually get to the pushing part. And here is a brief video.
And the way we do it is kind of you try to control things. I want you to grab onto your thighs.
So you're ready to go too hard, so be careful, there's no bed right here. Okay, don't go to put your foot down and fall. Okay, you're okay.
You can go this way. I'll go that way.
Well, pull your legs back, just open up your pelvis, okay? Just kind of
Okay, Sarah, the baby. You're complete. The baby's right here. If you actually hold the hand, I say hands. When you really concentrate on keeping air moving. I'll tell you when. Push it okay. Stop it. Again, little push. A lot of pressure when you push, that's okay. That's good. Again.
was a video showing birth, of course. I have had maybe 40 to 50 clients already, and I cry at every one of them. I don't know what it is, I cry at every single, it's just so beautiful, you know, I cry at every single one of them. So, types of pushing: spontaneous pushing, birthing person follows natural urge to push. The birthing person bears down in 3 to 5 second increments during contractions. Is not instructed to hold their breath. That is counterproductive to the pushing process. May be more comfortable for the birthing person to follow their body's instructions and their natural urges. Directed pushing, so the provider or coach or registered nurse tells the birthing person when to push. The birthing person is instructed to hold their breath and bear down, holding for 10 seconds, taking a break and repeating. Pushing can occur regardless of whether or not the person is having a contraction. May shorten birthing by about 10 minutes, and evidence does not support that it increases rates of perineal tearing or fetal respiratory distress. Positions to help with pushing. So again, going back to those positions: hands and knees, sitting on the toilet, semi-sitting, squatting, side lying, and closed knee pushing. Crowning or birth phase: short phase with only a few contractions, continuation of the descent phase where the birthing person's strong urge to push propels the baby down the birth canal. How can a doula help? Gives space for essential persons around the bedside, gives pep talks, praise, affirmations as needed. The placenta phase. The essence of the placental stage is approximately between 15 to 30 minutes. That is separation and expulsion of the placenta or afterbirth. Pain during the placenta stage is usually a few contractions, crampings, and stitching for any tears or lacerations. How can a doula help during the placental phase? Support the birthing parent through any interventions that are necessary. Help them turn their focus to baby after labor while any type of repairs may or may not be done. And support skin-to-skin contact and initiate breastfeeding. Yes, ma'am.
So why is the placental stage so painful in the story that we read yesterday, and then how can you support a birthing person in an experience like that?
So the placenta is attached to the uterus, and once the placenta is being expelled, there is about like this big of a wound inside of mother. So as you can imagine, that will be very painful. So you can just support mom by, again, turning her focus to baby. So usually the placenta is expelled naturally. Sometimes the care providers may manually expel the placenta. So I would recommend just continuing to turn mom's focus to baby, breastfeeding, still giving affirmations, letting her know how well she did. It's over, you know, baby's here. They're gonna be going home soon. Any other questions about this phase? Okay. So after the birth, between 2 to 4 hours following birth, the birthing person is flooded with and starting to come down from high levels of oxytocin and endorphins. How a doula can help facilitate skin-to-skin and breastfeeding, if that is what mom prefers in that moment. So we are going to take a look at an actual PDF birth plan. It is very good to have this completed and in mom's hospital bag, so that is one less thing that mom has to worry about during that moment. This plan can vary from person to person, so I feel like just allowing them to have the option on there, they can choose to prefer that or decline it, okay? So going towards the top really quickly, you just wanna put their name, their pronouns, the provider that they've been seeing, what type of setting they are having baby, what type of birth they are wanting to experience, any type of health factors, whether they're dealing with preeclampsia, hypoglycemia, or anything else. Definitely allergies, the birth team, of course, your name, doula, you're their advocate, any spouses, partners on the birth team as well. Any medical interventions or inductions in the case of a C-section, mom may have a preference to have one arm free, clear drapes so she can see exactly what's going on and to stay awake versus being medicated. Also consenting to different procedures. So mom may opt for an epidural as soon as contractions hit. She may or may not want an episiotomy, which is the manual cut that we read about yesterday in the story. Pitocin, monitoring, membrane sweeps, cervix ripening agents such as Cervidil, manual breaking of the water, the cervix balloon, which we saw yesterday during the anatomy slides, which is the Foley catheter for any IV connections. Pain management, if mom would like to opt for breathing, meditation, massages, the laughing gas, nitrous oxide, visualization, hydrotherapy, in the shower or the bathtub, vocalization, changing of positions, laying on sides, squatting, standing, all fours, whatever the birthing person prefers. Comfort measures, music is a big one from what I have been experiencing. They love to either have rain music in the background or their favorite gospel songs playing or anything that soothes them in that moment. Excuse me. The lights dimming. So you cannot have candles in a hospital setting, but what I like to bring are battery powered candles to kind of keep the lights dim and get the ambiance going. The room as quiet as possible, birth affirmations, aromatherapy. So I am a very big fan of bringing diffusers to the hospital settings. And aside from all the other great essential oils like lavender, citrus orange, clary sage is gonna be your best friend with us when it comes to essential oils and diffusers. Perineal counter pressure and massage oil. So the birth person can take advantage of these perineal massages during pregnancy, which is just kind of stretching out the area to prepare for labor. But they can also take advantage of this if the registered nurse and the rest of the care team are willing to do that to help mom with that during active labor as well. That can be done while mom is pushing. Let's see if mom's having a boy, if she wants baby to be circumcised or not, or uncircumcised, to be able to walk, if the monitor is allowed with that, to stay hydrated, to eat as approved by the doctor, and any other newborn procedures, such as if mom wants to keep her placenta or if she does not want to keep her placenta. Yes, and so this additional notes area is from a previous client that I had that she was very specific about, but these are not always the cases with hospital settings. But this particular mother did not want any pacifiers, no Pitocin unless she was actively hemorrhaging. What else? Definitely skin-to-skin delivery, breastfeeding. Delayed cord clamping is very important from what I have researched and have experienced. So a lot of moms are starting to opt for more delayed cord clamping. And this is just part of a birth plan that I have for photo consent. I don't like to post photos of mom or baby on any social media platforms without having mom's consent, or even having small video clips during that for advertisement purposes and all of that. So you just want to make sure you're covered in all areas.
And I'll jump in on.
So I am offering free mentoring for aspiring doulas, any Deacon doulas, any Wake Forest University students. So you can contact me at my website, and everyone should have a flyer at their desk. Also, I am holding a certified placenta encapsulation specialist training. So depending on if mothers want to take their placentas home, There are many different benefits to mothers who ingest their placentas, depending on a case-by-case basis. So I am also holding a class for that, and you will receive a certificate of completion after this class. And only for Deacon Doulas, you all will receive a 10% discount on the website. Any questions? Yes.
Can I ask, like, what are the benefits of ingesting placenta?
So, they vary case by case, but what I have noticed is increased milk supply. It balances mother's hormones. The placenta goes through a process of steaming and the traditional Chinese method, which is believed to warm the mother's body back up after it has went cold after having a baby. So I have seen increased milk supply, balancing of hormones, and many different psychological functions as well. Mothers who are second and third time mothers have reported not having postpartum depression after ingesting their placenta versus their first pregnancy. So many different, there are also some benefits listed on the evidence-based birth website as well. Any other questions? Well, thank y'all so much.
Prefer that you would have written the induction at that time. There are different reasons this occur. Most aren't dangerous and most resolve like over time. But it's gonna be like super frustrating.
Oh yeah, no, I get a new
I was
Oh, I was already crying.